And I've had a 40-year odyssey at this medical center this coming July. And that has provided me with a rich set of experiences. And it's about 2 of those experiences that I want to talk to you today that bear on this topic of duty to care in the face of personal risk. So, in 1978, December to be exact, almost none of us were aware, nor were we interested, in fact, that a second nuclear power generator was being constructed at 3 Mile Island, 8 miles from the Hershey Medical Center. And so it went online in December of that year. And about that time, probably in December, my wife and we were talking about our coveted 2-day getaway to Ocean City, Maryland in the spring. And we were making plans for that. And so we made reservations, and we planned to leave on Friday, March the 29th, 1979. And that was our plan, and we were looking forward to it. And actually, it was I think, a pretty warm, an early warm spring. And we were looking very much forward to getting away. At 4:37 a.m. on March the 28th, a set of circumstances occur that set into motion what is called the worst nuclear accident in a U.S. commercial nuclear power plant. That was the 3 Mile Island accident. It was rated 5 out of 7. So just for reference, I think the most recent Japanese nuclear disaster was an 8. So they revised that upwards. But it was called an accident with wider consequences. That was a category it was in. So what was happening here, and I had to remind myself, and I'll have to refer to the notes probably, was that at 4:37, the pump that fueled a water circulator in the non-radioactive portion of the plant went out of commission. And as luck would have it, the backup pump was undergoing maintenance, so it wasn't available. What happened then was that the water that cooled the core of the nuclear reactor, where the uranium rods were situated, started to overheat because there was no water bathing the core. And as this happened, there was a pressure relief valve that opened up as designed and released pressure into a container in the basement of the nuclear facility. And everyone thought, and it should have happened, that this valve would close after the pressure was released. But in fact, it didn't. And as a matter of fact, the operators did not know that it didn't close because there was a tag hanging over the indicator on the console. And so as a result of this, the water leaked out, the cooling water leaked out of the reactor and left the core unexposed. And so very quickly, but unknown to a lot of us for several hours and a couple of days, 50% of the uranium rods melted down. Well, when the operators recognized what had happened, they quickly added cold water into the system, and it met the hot rods and shattered them, and they fell into the bottom of the reactor. So, as this was happening, we were pretty much out of the picture because not much was mentioned to the public until about 28 hours after the event started, when the Lieutenant Governor, William Scranton, appeared at a news briefing to tell everybody that they had been assured by the company that everyone was safe, that there really was nothing to worry about, and that everything was under control. I was attending on the clinical service, but I was not on service at that time, and I wasn't on call the weekend of this event. And so, I was inclined to say, well, we should we should go with our plans. We were going to Ocean City for 2 days. So we, stuffed the car with the usual things that you need to take care of a 2-year-old. Cribs and stuffed animals and toys and food that we would need, and we left. And so as I got farther out of town, I should have felt better because I was getting out of the area of difficulty, but as a matter of fact, I felt worse. And as we got about 15 miles out of town on Route 322 on our way toward the shore, my wife and I, who sit in the back, started discussing this, and I said, I just have to go back. But what I want to do is we'll detour, and I'll take you and daughter Elizabeth to Baltimore to stay with your mother, and then I'll come back to Hershey. So that's what I did. I don't think my wife was particularly happy with that decision. But when I returned to the medical center, I found out there were some major ironies in this situation. The first being that a major medical center located 8.3 miles from a TMI facility had no emergency plan to respond to a nuclear disaster. Furthermore, as luck would have it, the chief of emergency medicine was at a conference in San Francisco, attending a meeting at the American College of Emergency Physicians, and because of the telephone blackout, this was far before cell phones, he was unable to check on things at the medical center, was unable to get a status report, so he jumped on the first plane available, a red-eye, coming from San Francisco, and arrived in the early morning on Saturday. From that point, he was involved 24 hours a day with hatching a plan for evacuation, possible evacuation of the medical center. And with something like this, already all elective surgeries were canceled. 1/2 of the inpatients in the hospital were discharged. And if the plan was that if a general evacuation was called, that patients would be transported by bus and ambulances to hospitals specified out of the area. Hospital staff would accompany them, and this was to be the plan if time permitted. If, however, an immediate crisis, a matter of hours, was suspected, patients would be moved into the basement of the hospital. So, to make matters worse about this time, we became aware of the fact that the National Regulatory Commission, the Nuclear Regulatory Commission, was concerned about the fact that they had detected a nitrogen bubble that had formed from the reaction of the heated core elements in the container vessel, and that this was possibly going to explode at any time. And if it exploded, it would destroy not only the reactor vessel, but the containment, and would liberate large amounts of radiation to the area. So it was not a comfortable situation again, for sure. Estimates of the amount of radioactivity that would be involved varied from huge amounts to very small amounts. There had been some releases of radioactive gases, xenon and krypton, into the atmosphere, as well as some releases of radioactive water into the Susquehanna. But there was no assurance of how much that was and what the risk was. This wasn't helped by the media, who had various estimates, who were reporting various estimates of the risks of meltdown, which had already happened. We just didn't know it. So schools were closed and residents were told to stay indoors. Farmers were advised to keep their animals inside and to feed them with stored grain. And the NRC advised the evacuation of preschool children and pregnant women within 5 miles of the medical center, of the TMI. And so a Red Cross evacuation center was set up at the Hershey Park Arena. and was staffed by physicians from this medical center. There was no general call for an evacuation. However, over the 3 days of this event, 150,000 of the roughly 600,000 people in this area, within 20 miles of TMI, had left the area, many stopping to close out bank accounts and to empty their safe deposit boxes. Mall parking lots were empty, and the community became a ghost town. The only vehicles traveling on Chocolate Avenue were trucks with loudspeakers broadcasting warnings to stay indoors. All telephone communication in and out was cut, and I was unable to call Baltimore to talk with my family, and so there was this eerie sense of isolation that was pervasive through this area. There was an estimate that approximately a third of the medical care providers left the area on Saturday, March the 30th. Excuse me, by March the 30th. Our hospital director was quoted by Patriot News as saying, "Out of this whole thing," this is after the fact, "even though employees were scared to death, there was virtually no irresponsible behavior, and I was impressed by the willingness of large numbers of people to step into the valley of death." Things took a turn for the better when Harold Denton, who was previous director of the NRC, was brought to the area by President Carter, and he was the most level-headed person around. And through what he could tell us, he said, "Don't worry about the hydrogen bubble. It's not going to be a problem because there's not any oxygen in there for the hydrogen to explode." And he was giving more reasonable estimates of the amount of radiation that had been released. And then following that, the next day, President Carter and his wife, Rosalind, came to this area, and he and Governor Thornburg and Harold Denton toured the facility. And this effect had a calming effect on the population. To see the president and his wife here, this relieved a lot of tension. Following the accident, estimates of the radiation dose that people within 10 miles received was 8 millirem, and that's equivalent to a chest x-ray. And no more than 100 millirems to any single individual. And 100 millirems is about a third of the usual background radiation received by U.S. citizens each year. We have some health physicists here. Are those accurate? Okay. Another irony around the TMI accident was that the movie The China Syndrome had been released 11 days before TMI, and actually was playing at the Elk Theater in Middletown, which is 2 miles from 3 Mile Island. In it, the characters, Jane Fonda plays an investigative reporter, and her videographer, played by Michael Douglas, happened upon a cover-up of a near meltdown in a nuclear facility in California. Here, Jack Lemmon plays the nuclear plant operator, released 11 days before TMI.
Come up to me, Barney.
I remember the afternoon in 1982 when I was in the clinic doing a bone marrow aspiration on a 10-year-old boy because of fever of unknown origin and low blood counts. This young man had hemophilia, degenerative factor VIII deficiency, and was a member of our comprehensive care clinic. I had seen him frequently, and he had been well, except for occasional bleeding into his joints and muscles. His bleeding episodes have been treated routinely with clotting factor concentrates derived from pooled plasma from thousands of donors. The time had finally arrived when many of our patients with hemophilia could become independent of hospitals and clinics by self-infusing freeze-dried concentrate at the first sign of bleeding. They could play some sports, go camping, and have elective surgery. Several had fathered children, and some had earned college degrees in education, law, and architecture. At the time, we were teaching our medical students here that although bleeding remained a major cause of death in hemophilia, patients like this patient, John, had a near normal life expectancy. While aspirating his bone marrow that day, my mind kept replaying a recent CDC report of 3 adult men with hemophilia who had developed unexpectedly a syndrome characterized by impaired immunity and an unusual form of pneumonia that was previously seen only in immunosuppressed cancer and transplant patients. All 3 patients in this report had received clotting factor concentrates. Also, a month before that, the CDC had also issued an update on cases of unexpected acquired immunodeficiency in 4 distinct groups, namely gay and bisexual men, intravenous drug users, patients living in the U.S., and persons with hemophilia A. A few weeks later, John died with combined infections from both pneumocystis and fungal infection, both AIDS qualifying diagnoses. He was the first child with hemophilia and the 5th hemophiliac with acquired immune deficiency syndrome reported by the CDC. We had no idea at the time what was causing this syndrome or how it was transmitted. Was it a bacterium? Was it fungus, parasite, a virus? Were we being exposed to airborne organisms as we cared for our patients? All of this was unknown. By 1988, we of course understood a lot more about HIV, how to detect it, and how to follow patients. At that time, of our 207 patients with hemophilia, 1/2 were seropositive for HIV. And 95% had met diagnostic criteria for the AIDS syndrome. The site of our medical practice was extending from the usual outpatient patient sites and general inpatient wards to the intensive care units, where families gathered to mourn the death of their sons, brothers, grandsons, fathers, and uncles who were dying of respiratory failure from pneumocystis pneumonia, mycobacterial infections, and fungal infections. So reflecting on the many months before we knew the etiology of AIDS and how it was transmitted, I remember that I silently worried and ruminated, if you will, about the risks of contracting the disease from the many patients I was treating and transmitting it to my family. Once the epidemiology and transmission of HIV virus was understood and universal precautions enacted beginning in 1985, it was apparent that the risk of contracting the disease from our patients was low as long as we prevented needle stick injuries and splashes of blood on mucous membranes. So I would like to end my part of this by just saying that I didn't consciously philosophize about the ethical dilemmas posed by the 2 situations that I described. Again, it seemed like the right thing to do. But I guess these are the issues, the ponderables, if you will, that hang over us in these times of crisis. A lot of uncertainty. One can't see radiation, one can't see HIV. We didn't know much about it. What was the risk of death and personal loss? Would we have a home in central Pennsylvania? Under the moral and professional obligations, what was the limit to altruism and beneficence? And was there a relationship between the degree of risk and the duty to care? In other words, as the risk increased, was our duty to care less? And what is our contract with society regarding treating patients and individuals in these settings? And then also this idea of conflict of obligation, torn between duty to family and duty to our patients. So this is food for thought as we go on today. Thanks.
Any quick questions for Joe before we go on to the next part? We'll have plenty of time to talk later.